What's up, everybody? It's Dr. Bailey with Dr. Bailey's Evolved Health and Wellness. Another beautiful Monday. Starting a little bit earlier today. Um, this will be a kind of an abbreviated version. I apologize. I came down with COVID on Monday, or not Monday, Friday, and that's no joke. It hits like a Mack truck. I think Friday I ended up canceling the last bit of clinic and fell asleep Friday at 5 p.m. I think I finally crawled out of bed Sunday at noon, um, and uh, drank some water, ate some food, and fell back asleep. Um, about 50% today. I'm fortunate, being able to work from home or whatever, but it's definitely a rough go. Um, my wife caught it probably coming back from her vacation, honestly, and I was masked up going through the airports and traveling stuff. You almost can't avoid it. Isolated her for a week, and I try to take care of the house and keep clinic running and take care of the kids and everything else. And eventually, it caught up with me. And like I said, it hit me hard on Friday, and um, I'm real fortunate. I'm a big believer, kind of like I think everybody is aware of taking care of yourself and providing yourself with the most benefit as possible. So I'm a big believer in supplementation, multivitamins. Uh, I keep a ton of vitamin C within reach at all times, and like I said, I think that's why I've been able to do what I've been able to do. Now, today's talk was the reason I didn't just cancel it. I wanted to talk about it. Is Veterans Day is coming up. I've been in the military for a long time. Um, the excuse me. Um, a big thing I hear all the time in our veteran groups is, man, I don't want to lose my benefits. I don't want to lose my benefits. And you absolutely cannot, without a shadow of a doubt, there is no risk to any veterans' benefits when it comes to cannabis licenses, cannabis use. Even in states that don't have a medical program, they cannot take your benefits from you for using cannabis. Now, will a lot of doctors not prescribe medical or pain medications with a cannabis license? Yeah, VA docs are very similar to other doctors, and I usually tell everyone the same couple things whenever I talk about cannabis and pain meds. I tell folks you've got to really, and this is a stretch, but just follow me. You've got to look at cannabis a lot like abortion. And I know that you're like, what do you mean abortion? Well, the reason is this: it's a legal thing, but not every doctor is going to morally or ethically agree with it for whatever reason. And so if they don't agree with it, they don't have to practice it. And the same thing goes with cannabis. Now, in the VA system, obviously, they cannot prescribe medical cannabis due to the fact that it is a federally legal or controlled substance, Schedule One. Now, that's going to change? Regardless of who wins the election, we knew that there was going to be some policy changes when it comes to cannabis. And actually, Ron Durbin posted. I don't know if it was today or maybe I just saw it today. It was posted yesterday about wide sweeping federal or wide sweeping federal legalization. And I don't see that happening for the exact same reasons that Ron did. That there's too much money at stake to each state. So I think that there will be some changes to scheduling. But as far as it goes from the veteran standpoint, if you have a family member that is a veteran, I'll be glad to sit and talk with them. I've been in the United States Army for a little over 11, 12 years, something along those lines. The 12th of November is my anniversary date from when I signed up. Um, I have 2 more years left on my contract, and it's something I work with several of the counselors here at the PTSD clinic in Tulsa. We also work with a couple of the guys over in Oklahoma City to try to increase, because what we've seen is in that veteran population, especially the PTSD population, it provided really significant decreases in clinical presentation for PTSD flare-ups or suicidal ideation, major depressive disorders, those types of things. So we're seeing a phenomenal improvement there, not just in quality of life, but elongation of life. So it's something we feel pretty strongly about. I have had a lot of people hit us up about Veterans deal or Veterans Day deal. Um, I tried to come up with a couple different ways to do a veterans program with the online scheduling that we have, and I wasn't able to figure out a way to do it. What I did this year is we made that a pretty decent sized contribution to Kyle Early's Veterans Relief or Veterans Outreach group in Oklahoma City. I've got another group here in Tulsa that I'm going to start working on here in the next few days as well. Uh, Again, guys, these videos for me, it's trying to make them as informative as possible and about things that you guys want to hear about or want to know about. There are some big topics I want to hit back on. And I really want patients to be able to hit us up with questions, even if it's not about cannabis. If you have a question about your blood pressure, if you have a question about cardiovascular risk or anything that's medically relevant, shoot me a message or comment on the videos, and I will be glad to help in any way I can. Because a lot of times, what I'm finding out in our patient population in Oklahoma, especially, it's just education. We just don't know, and you don't know what you don't know. And so if you have questions about blood pressure, I'm a prime example. A lot of people are aware. I just fought 2 weeks ago in Oklahoma City on the 24th. We won that fight. Incidentally, I destroyed my knee in that fight. I blew my ACL, strained my MCL, and tore my meniscus. So I have to go see an orthopedic surgeon for long. But um, in that fight, I cut 60 pounds over, I don't know, it was from July 5th to October 23rd. What I noticed with that, one, it was a long social experiment. I mean, it was a 14 or 15 week, very strict diet, very aggressive exercise, those types of things. But my blood pressure in July was 158/90. I was stressed all the time. I was working real hard. I was overweight for my size and frame. And by the time I was in the 160s or even low 170s, my blood pressure was 118/60 on average. The biggest two things that contribute to blood pressure issues are typically weight and salt, sodium. So those are just a couple of things that I really wanted to try to hit on. Those are just examples. Whether it's diabetes, blood pressure, cholesterol, I mean, you name it. I've got some ideas and I got some ways to try to help. By all means, drop a message on here and I'll get everybody taken care of. It's been my pleasure. Military service has been a good one. Um, I will be gone out of the office next July for an extended period. Our training goes to California. We're going to a pretty big training station. It's actually a month long, but I'll be gone about 10 days. So July next year, I will be closing Evolve down for about 10 days while I'm out of the state. Otherwise, the only other time we really should close for any significant period of time is right around Christmas. I will be open between Christmas and New Year's. We will be open for just a brief bit. I think it's already full, but on Black Friday, trying to help out folks as much as possible. Side note, real fast, something that's popped up a lot because again, I want these to be as educational as possible. The renewals. People are going in and they're doing the renewals for their cannabis license. In Oklahoma, it's going to ask you date of physician signature. I'm averaging about 10 to 15 a week of people getting rejected. And what they're doing is, so today's date, for example, is 11 09 2020. If you type in 11 09 20, the website will automatically convert that to 2019. You will get rejected. They'll send you an email saying your physician signature is expired, which is not, but that's what they will tell you. So just make sure that you monitor that. The renewal process is pretty straightforward. They're getting the cards out fast, and they've been keeping up with everybody relatively well. All right, guys. That's about all I got for today. I apologize. Um, we're going to really cast a wide net for the next couple of weeks. I really want to get some topics together that people are really interested in. I want to revisit some topics as well because I feel like from time to time we need to do that. I'll probably will hit back on some of the blood pressure issues. I know that there's been a couple cardiologists here in Tulsa that have told patients, well, we're having patients with elevated blood pressures, and what they were correlating it was high THC percentages, which can be plausible. from the stance that it can really increase your heart rate. And if everything else isn't even, that increase in heart rate can drive your pressure up a little bit. But it shouldn't be long standing because it's a vasodilator on the backside. So there is some other issues to talk about there. So we'll probably revisit onto that, revisit on the diabetes going into the winter, and different options there. And again, if there's anything that you need, shoot me a message to the Evolve page. I personally respond to all those. I'll probably be a little bit slower the next couple of days. I'm not going to lie. But I'm typically pretty fast with that. So I hope you guys all have a phenomenal week. Again, if there's anything I can do to help, let me know. If you know any veterans that have some questions about this, share this video over to them, have them take a look at it. Also, have them message me directly. I'll be glad to, they can message my personal Facebook if you like. It's just B Bailey DO. Or they can message the Evolve page. If it's, I'm all about helping veterans in every way that we possibly can. It's just it's kind of my thing I prefer to do. So appreciate you guys all. Have a great week, and we'll talk to you here later on.